The president received 2 experimental drugs while at Walter Reed, remdesivir and dexamethasone. Uba Ali spoke with the Mayo Clinic infectious diseases physician to find out more about these drugs.
I learned a lot about COVID. I learned it by really going to school. This is the real school.
The president's recovering and learning while receiving treatment through an IV for remdesivir, a new drug, and a steroid, dexamethasone.
Mayo was very fortunate to be one of the first sites in the United States to have these trials available.
Mayo Clinic infectious diseases physician Dr. Stacy Reza says remdesivir is the only drug that has proven phase 3 efficacy trials, making it available for emergency use for anybody who has access to the drug.
If I were to become sick with COVID-19 syndrome, I would want to receive this therapy as well.
And through worldwide trials and thousands of patients, the use and dosage of the antiviral drug was released.
This is a therapy for COVID. It's an antiviral medicine, which means if somebody has the virus in their body and it's replicating and it's making them feel sick, this is a drug that fights the virus itself. It does not prevent infection like a vaccine will hopefully do. 5 days is adequate, and after 5 days, if a patient is very sick, it does have the option to extend it to 10 days of therapy if it's needed.
However, if someone becomes very ill, the steroid dexamethasone can be used.
So remdesivir would be used earlier in the syndrome when people are in more the viral phase of the syndrome. And then if somebody continued to get worse and became significantly ill or presented when they were already significantly ill, it may be reasonable to use steroids on top of that.
And while there's several different trials happening at Mayo Clinic, there's only 2 that can be given outside of a trial.
So outside of remdesivir and maybe dexamethasone, there is no treatment other than those. Everything else can only be given through a trial.
In Rochester, Uba Ali, KTTC News.